doctors in England are planning a 6-day strike from the 7th to the 13th of April. So what are the core demands behind this action?
The main two demands are that there is progress towards pay restoration to redress the fact that junior doctors, now called resident doctors, had lost over 30% of the value of their pay over the last few years. And they've made some progress towards that, about 7% of that, but they're still well over 20% adrift of the value of their pay. That's the one thing. The other thing is that there are simply not enough doctors in this country, and they were asking for more doctors and more training posts, because despite the fact that the NHS desperately needs doctors, there is a growing unemployment, a risk of unemployment amongst doctors, which is hard to believe, but it's true. And doctors who are stuck in posts that aren't accredited training posts. So they're treading water and doing the work of the NHS, but not being able to progress so that they can become, for example, trained GPs or consultants. So those are the two demands: pay restoration, redressing the workforce issues.
Okay, so as you said, junior doctors say their pay has dropped in real terms over years. How has that affected recruitment? You said obviously there's not enough doctors, and retention and patient care.
There's a lot of goodwill for the NHS and a lot of desire to work for the NHS, but the situation over the last 10 years especially has led to demoralisation and a feeling that if you complete all your training as a doctor, you may then not have the satisfaction of a job where you can do your best for patients. From COVID, where people talked about the fact that they could not give the patients the treatment that they deserved, and they had a kind of moral injury where they felt they were letting themselves down, they're letting patients down. Now, as that gets into the public mind and students are in that frame of mind, there's a growing feeling that doctors and nurses, when they finish their training, are going to leave the profession, which is a tragedy, or they're going to go abroad. And the risk of that is that, for example, in 1 year, 40,000 nurses have left the NHS. Wow. And 20,000 doctors have left the NHS. And that is an injury to the NHS that we cannot afford to sustain.
Because I think confuses a few people. It says the government has withdrawn an offer of creating 1,000 more doctor training posts. That seems to be their sort of threat to get you to agree to a new contract. Why would they offer and then withdraw? Why would that upset the BMA?
That's a very good question. The last resident doctors' strike was in December, and I'm a retired doctor now, and I'm not speaking for the BMA, I'm speaking as a campaigner, but I spoke to doctors on the picket line, and they were shocked really by Wes Streeting at that time, saying that the doctors were irresponsible and they were going to be the cause of patient death and patient harm. And none of that happened. And this time round, for some reason, the Prime Minister himself has waded in with a real bullying tactic, saying that if you don't call your strike off, we will withdraw the commitment to 1,000 training posts, as though the two things are the same. The need for extra training posts is absolutely apparent, because doctors finish their training at medical school and they finish their 2 years, which are called foundation years, before they start to specialise. And they're on the scrap heap. They're either unemployed or they can't get a training job. Now, that commitment of 1,000 extra training places was very much welcomed by the BMA. In fact, however, those weren't extra jobs. They were a transfer of jobs that doctors were in locally employed by trusts, not in training, transferring that to becoming a training place so that there was a future for them. So in a way, that was building for the future of the NHS, building for the chance of extra GPs, extra consultants, extra anaesthetists, radiologists, surgeons, and so on. And the fact that the government now, with Starmer wading in, has withdrawn that offer is shooting the NHS in the foot, and it's a real insult to the general public as well, who desperately need an NHS that works.
Yeah.
With the strike scheduled right after Easter, how will that affect NHS services locally?
Very good question. I'm retired. I've been amazed by the solidarity between consultants and resident doctors who were previously called junior doctors. And of course, a resident doctor today could be the consultant tomorrow if they finish their training. And the consultants know that what the resident doctors are calling for is actually putting the profession on a stronger footing, and therefore the NHS itself on a stronger footing. But when the consultants have stepped in to cover the resident doctors on strike, and they've done so willingly, it's very hard work for them, what you have is really experienced clinicians, really experienced consultants, and confident in their decision-making. So, in fact, they run the A&E department very efficiently. They can assess patients on wards and say that they are ready for discharge more efficiently. There has not been a safety concern during these strikes, but what it has meant, of course, is that business as usual, outpatient services and non-urgent surgery has had to be postponed to some degree. And although the government says that there's virtually no impact, that's just not true. There's been a massive impact over the last 15 occasions of resident doctor strikes.
So this dispute has been running since March 2023. Do you see an end to it? What do you think is the way forward?
I think there has to be an end to it, and the end, as in all major disputes, is by negotiation and mutual respect. And the doctors, as I understand it, felt that they were onto a good footing in discussions since December with the government. They were talking about extra funding to deliver pay restoration over a specific period. But this year, what the BMA have said is that the money that was on the table for this year has suddenly been changed and spread over 3 years, and there wasn't a commitment that the training posts would be fully funded off into the future. It was a sort of temporary thing. I think that the government has people in charge of it, including Wes Streeting, who talk a very confident talk, but they actually don't know anything about the inner workings of the NHS. The NHS has got to be fixed to stop 16,000 people dying avoidably because of delays in urgent care, so the disasters in maternity care, the inability to find a GP or the inability to find a dentist. There's systemic problems, and Wes Streeting thinks that he can solve that problem with AI and with digital gadgets. And it's just for the birds. It's so far from reality as to be really scary that our politicians can think like that. The NHS has to be fixed, because if it does, it starts to fix the health of the population, and it starts actually to fix the economy.
Yeah.
For every pound invested in health, you actually get a £4 feedback, a reward that builds on the investment, because health is so critical to the health of the country.